Let's call our meeting to order. My name is Kay Leach and I'm serving as the chair of this board. With me today are some board members and I'll ask them to acknowledge themselves as I call their name. George Hageman.
Hi, I'm a retired microbiologist from IU and I've been a longtime board member and resident of Bloomington since 1972.
Okay, and Steve Pritchard.
Hi, everybody. I'm Steve Pritchard, retired dentist, longtime board member, not as long as George or Carol, but I've been around a while. So, yep.
Carol Talukian.
Hi, retired pediatrician, been on the board for a while.
And Bob Wren.
Hi, Bob Wren. I am a retired obstetrician gynecologist. I've been on the board for about 4 or 5 years and enjoy working with you people.
And also with us today, we have Penny Caudle, which is our administrator at the Monroe County Department of Health.
Good afternoon.
And I think is Margie on?
I don't see her.
I don't see her yet, but also with us, I saw behind you was Dr. Sharp, Dr. Tom Sharp, our health commissioner. Dr. Sharp, are you there? There he is.
You need to introduce yourself, Kay.
You're muted,
I'm
John.
sorry,
You need to introduce yourself.
I did. I'm Kay Leach and I'm serving as chair of this board. And I'm a retired registered nurse who was also a nurse educator.
That's right. You did important work.
I did. Okay, is Margie? Yes, Margie, I see that you're here now. Margie Ross, our legal advisor. Margie, you want to introduce yourself? Margie, I think you're muted.
Sorry. Margie Rice, I'm a county attorney and I'm assigned to represent the health department.
Okay. We do have a couple of board members that aren't with us yet, but they're coming on. One is Mark Norrell and one is Ashley Cranner, and I'll let you know when I see that they come on board. Okay, first on our agenda is public comment. This is a time that we take every meeting and we always like to hear from the public. So if anyone out there has comments for us, please keep your comments to 3 minutes. The technical staff will give you a little warning. It'll be kind of a musical note to let you know your 3 minutes is about up. But if you have an issue that you'd like to bring before the board, just go to the bottom of your screen and raise your hand and let us know and we'll recognize you. Is there any public comment at this time? I don't see any public comment. Does anybody, technical staff, do you see comments?
No, none.
Okay, so Andrew's with us. Welcome, Andrew, our technical person. Okay, next on our agenda is approval of the August 23rd meeting minutes. If you look at your agenda, it says June, but it's August 23rd minutes. Did everybody get the minutes? Did you have a chance to read them?
Yes.
Any comments you want to make? Corrections?
I would move that we accept the minutes as written.
I'll second that.
Okay, we have a motion and a second. Let's do a roll call. George?
I vote yes.
Mark isn't with us yet. Steve?
Yes.
Carol?
Yes.
And Bob?
Yes.
And I also vote yes. So the minutes will stand approved as written. Okay, next is public health reports. Penny, you're up first.
Sure. Just a few things to kind of go over last minute updates. In terms of staffing, I do want to congratulate both Kathy Hewitt and Ashley Bergquist. They are both current employees with our department. Kathy will be taking the position of Population Health and Outreach Manager, and Ashley will be taking the position of Environmental Health Services Manager. Will make that transition and they will start those positions in early October. Just have to kind of work out a few details and work with pay periods and those kinds of things. So we're happy to do that. And then we'll be requesting permission from council to fill the vacancies that they will leave behind. I think everybody knows Kathy Hewitt. She's been with us for a long time now. And Ashley has been with us for several years in a part-time way and then in the temporary position, and she is about to finish up her PhD. So we are welcoming of both of them into those new positions, and thank you for your work to get those positions added to our department. The testing site, we had hoped that the testing site back on Morton would be reopened early this month, and we're waiting on a contract with the state. We did have a call with them earlier today, and there's been some changes, but we do anticipate we will have a testing site up within the week, but some changes to kind of our initial plans. So as those get finalized and confirmed, I will share that not only with you, but we will do a press release to make sure everybody's informed. But I don't have all the fine details because we got off of the phone at 2 o'clock before I got on another call at 2. So just know that we are still working on that. The state did come and spend a Friday and Saturday doing testing and vaccinations. Shout out to Cook Group for allowing us to use their parking lot facility out on Profile Parkway for that. We appreciated that very much. And we had a couple staff that helped work that clinic that day. So we're grateful that we had Kate, who's on this call, and Melanie, who were willing to step in when somebody had to leave. They were willing to step in at the last minute and go out and do some testing. So thank you to them. The state has changed some of their school guidance, but options for schools in terms of quarantine. So because we know that masks are so very important in classroom settings, they are now giving schools an option. If a classroom is completely masked, if everybody in that room, teacher, faculty, staff, students are all masked, they do not count shields as being a mask, then if there is a case in that classroom, they do not have to quarantine the close contacts. They have several case studies, they sent this to you, where they are showing that the masks are what really make the difference as opposed to the distance. If anybody in that classroom is unmasked, then they have to go back to the standard protocol for figuring out who those close contacts are and having them quarantined. It does not mean that they don't contact trace those individuals, but they don't have to quarantine. And that's in an effort to keep the schools opened, recognizing the information that's coming in regarding safety in classrooms and the evidence behind masks working. Seven Oaks did file an appeal, and the commissioners today scheduled that hearing. It will be on September 16th at 2 p.m. And then in terms of the numbers, we are holding steady in yellow advisory this week, still at 1.5. We did have, last week, our cases rose over 200. They were back down under that level. They were at 181 per 100,000 this week. We stayed at 1.1, which is a higher level of yellow because our positivity rate was just over 5%. So the trending, if you look at the cases per day on that rolling average, we are starting to tick downward, and we're hopeful that that will continue. But that's kind of where we are. Sampling for the variants, Delta variant is clearly the most prominent variant and what's circulating in the community. And our vaccination rate today was at 58.9% fully vaccinated. We do have some zip codes within our county that 47, I think it's 401, is over 70% fully vaccinated. We have some other zip codes that are over 60% vaccinated. And then we have some that are just at 50 or so vaccinated, fully vaccinated. Amy will talk to you about our outreaches that are coming up. Just a couple of things about IU. They continue to do their testing. They are reporting, much like our physicians in town are reporting, that there's a lot of symptomatic testing occurring, but there's also a lot of non-COVID things circulating. So RSV, other respiratory infections that people are having symptoms and they're going in to get tested, but we are seeing a fair number of those not be positive. And that gives us some good news. The hospital is using a lot of high flow oxygen, a lot of vents at the moment, but are seeing some signs that hopefully there will be a slowing of that as well. So that's my general updates that I have for you. And then Amy will update you more on kind of our outreach efforts.
Penny, there was someone on the chat that asked if there was a cost to the opening on Morton.
Well, there is certainly a cost to opening any clinic. They are very expensive to run. Part of what we were waiting for with the state was a contract, which is what we had last year. So a grant contract. So there was some money. And I will tell you that that grant did not cover all the expenses. So IU Health, Indiana University, the city, the commissioners at the county level all chipped in funds to help operate that site. And we were able to keep it open an extra month. The grant actually ended in June, and we were able to negotiate that extra month and keep it open till July. So there is an expense. With what we are looking at, there will be an expense, but it will be on the state's budget and not on our local budget. And so we are happy to let them handle that as opposed to deal with grants and claims and all the extra pieces that go into that cost time and money as well and aren't necessarily always seen as the operational expense.
I wondered if they meant cost to an individual getting tested.
Oh, I am terribly sorry. The state funded sites are free sites.
Okay. And I also saw something on the chat about the school. I wasn't quite sure what they were asking, but anyone that had questions about schools, they could certainly contact you, couldn't they?
They can, and I will tell you that the schools are certainly wanting your input and your thoughts on whether or not you will support them in, and I was going to talk about this with the regulations, but whether or not you will support them opting to use we are fully masked, and so we don't have to quarantine as long as they're following state guidance. Are you okay with that? And I've let them know that you were meeting and we would be discussing that. So they are anxious. And I know there's some people on this call who are anxiously just wanting to know if the school if the health board supports that or not, as the schools make their decisions about what they will do. It's not something they have to do. It is an option that they have.
I also just noted that 2 board members have now joined us. They've gotten on. Ashley Cranner. Ashley, you want to introduce yourself? You're muted, Ashley.
Hi, Kay. Hi. Yeah, my name is Ashley Craner. I'm currently the vice chair on the board. I think I've been with the board for 12 years, roughly, and I worked for the Monroe County Health Department prior when I was in graduate school, and it's just been an honor to serve and be with all you guys.
Thanks, Ashley. And Mark Norrell. Mark, you want to introduce yourself?
Certainly. Apologize for joining late. I had a little problem with Zoom here on campus in my office, but with the help of our IT fellows, they were able to reinstall the software application and allow me to join. But anyway, Mark Norrell, Senior Lecturer in Healthcare Management and Policy at the O'Neill School of Public and Environmental Affairs at IU Bloomington. I think I joined the board in 2015, something in that neighborhood, 2014. I can't recall exactly, but prior to coming to Bloomington and teaching at IU, I was a hospital administrator for 25 years in Florida and Idaho and Kansas.
Thanks, Mark. Amy Meek is from our public health clinic, and she's going to give us an update. Amy?
Good afternoon. The Public Health Clinic has started our school-based clinics. So that started this past week. We will be in all of the MCCSC and RBB schools offering COVID vaccines to all those that are 12 and older. We're also offering it to staff while we're there. So if a staff member wanted to get a COVID vaccine and hadn't yet, they could get it while we're there. And then we'll be making our second trip in to give that second COVID vaccine and give the flu shot at that same time. And when we do flu shots, that will be open to all ages in the school. So kindergarten on through 12th grade. We have hired an outreach coordinator, so we're really excited about that. Her name is Zara Valencia, and she'll be with us for a year under a COVID grant. And so she's helping to coordinate all the school outreaches, the shelter outreaches, and any other community outreaches for not just COVID vaccine, but for all vaccines. Right now, we're planning to start on September the 20th with public-facing vaccine appointments here at Miller Drive, and that'll be Monday through Thursday and on Saturdays. So if people can't come during the work week, they have some Saturday options as well. We're doing that in anticipation of that third dose or booster dose maybe being approved by then. If it doesn't get approved by then we're still here for people who need that first dose or second dose. So we'll be having regular hours here at the Miller Drive office right now, at least September and October. We have hired a couple other temp nurses to help staff that, and the hospital is helping us with staffing some of that as well, since most of our staff will be at schools most of the days. And I think that's all of my updates.
Anybody have questions for Amy?
I have a quick question, Amy. For the students that are eligible, 12 and up, does it require parental permission to get the vaccines?
Yeah, so all the vaccines, the flu shot and the COVID vaccine, we send a lot of paperwork home with all of the students, and they have to send it back in advance with parent permission and consent forms. The flu shot also has insurance information we have to collect ahead of time. So when we show up that day, we know who we're vaccinating and how many we're giving.
Any other questions for Amy? Amy, you do a lot of good work. Thank you.
Thank you.
Okay, next on our agenda is down to old and continuing business is our regulation review. Penny, do you and Margie want to tackle that one? And could we maybe have a technical staff to put it on screen for us as we go through and review it?
That would be great. And I can get us started. And I think Dr. Sharp wanted to chime in about it as well.
Great.
So the current regulation is set for through September 30th, unless we were to reach a level of a blue advisory, and our cases per 100,000 were under 50. So right now we are not in that place. So this order is still in effect. Our numbers again are encouraging of late, not overly encouraging, mind you, but a little bit encouraging. There is probably no way that we can get to that metric by the end of September, even with improvement. So just to kind of give you that little tidbit, kind of where we are. As you know, we can't move from yellow to blue until we've essentially been in blue for 2 weeks. So that takes a little bit of time. And moving to blue does not necessarily mean that our cases per 100,000 are at 50 or below. So it will take a little bit of time to get there. The primary things that this regulation does, and is requiring masks. That's the main thing that this is doing. There's a signage requirement, and last update added that this good signage had to be at all entrances, not just public entrances. We've not seen a lot of complaints or concerns about that. We are getting lots of complaints that come into our hotline. Some are about signs, but for the most part, they are about people not wearing masks, or not having 100% of the people wearing masks. The other portion of the order is regarding schools and requiring them to wear face coverings during school unless there is an exception that's listed in here. I know that there was a question in terms of our current regulation does allow, it really is only again about the masks. So for instance, the change with the state guidance for quarantine would not necessarily change this, other than that our current regulation requires that everybody's masked in the schools. So that would mean that if they are following our recommendation, if they also follow the state and wanted to not quarantine students in that classroom where everyone was masked, they wouldn't need to. So again, I think you can tell us if you are okay with that or not today, and we can move forward with that. So
Can I ask a question about that?
Sure.
The question I have is and it's because I just had trouble when I was reading what the state said. So there are certain exemptions, like, medical exemptions and those sorts of things. So if we have a kid in the class who has a medical exemption, then they're not all wearing a mask, right? So the quarantine situation, that quarantine gift is off.
That takes that off the table.
Okay, all right,
Yes.
that was my question, thank you.
Yes. And for instance, in our county code, we allow for a face shield, but the state guidelines around that quarantine does not accept a shield. So if you're using face shields in place of masks, then you would still have to follow regular quarantine procedures. Yes. So just to kind of tell you where we are. So that's the two things that are in the order that you're really looking at. We are getting more complaints. People are adamant. Some are adamant that they are not going to follow the regulations. Some in part, they just, maybe they'll post the sign, they'll encourage people, but they will not require people to follow the guidance. A few of them have said, I don't agree with this, and fine us, we're not going to do it. We again kind of work through that process with them. But what we're hearing most often is that people will post the sign. They might even be willing to ask someone to put the mask on, but they are not willing to put their employees in harm's way. And I shared with you a call that I got about one business who they escorted somebody out because they refused to put a mask on. person returned with a knife and drew the knife on the employee. Now, they were not injured physically. The person was arrested, but that is what businesses are telling us they're concerned, and they don't want to put that employee in harm's way. The hospital has even indicated that they have security at the door, and they are having those same situations where people are coming in and kind of starting at an elevated level of anger, right? That before they were upset and maybe you could de-escalate that situation and maneuver around it, and it didn't get to this other level, but that people are really coming in at a heightened level of anger about the masks, and it is putting businesses in a precarious situation, and they're concerned for their staff safety. So I'm saying this so that you just have the full grasp of what I think we need to think about as we look at this mandate. You know, are we getting the outcomes that we want from it? We know that masks work. They are beneficial. I think many people would say probably one of the reasons that we are still in yellow has something to do with the mask mandate. We are, as far as I know, the only county in Indiana that currently has a mask mandate. So we know that they work. We know why we have them, why we have this order. But what I'm hearing from people makes me ask the question is, does the mandate move people who are unwilling to wear a mask and get them to wear it, right? And what's that balance between cost and benefit? So the time and the energy that we put into following up on those calls and complaints, the time and energy and money spent on security, those kinds of things, what businesses even are putting into that, versus us having the time and energy into a vaccination campaign or really working kind of on the testing side of things. So those are the things that I think you just need to keep in mind as you think about this today. It's a delicate balance, right? Again, we know that the masks work, but the question is, are we getting the impact that we want from the mandate? And that's kind of a question for you. The options that you have, this order is set to expire on 9/30. So you can extend it today. You could rescind it today, right? That's an option. It's also set to expire if we reach blue with that 50 or less cases per 100,000. That's not likely to happen by 9/30. So those are really the options that you have as you look at this. Certainly you could change one piece of it if you wanted to do that. But that's just kind of, I already kind of gave you the numbers in terms of where we are. I'm happy to answer any questions. I don't know if Dr. Sharp has anything that he wants to add at this time or not. He does.
Good. I was going to ask for his opinion on this.
Yeah, Penny covered that quite well. And there really is a point of diminishing returns with the mandate versus strong recommendation.
How can you get closer to the speaker? It's hard to hear you.
What's that?
Get closer.
It's hard to hear.
Oh, where's the speaker?
There, over here.
Okay. I'll cover that.
Yeah, here, you can sit here.
Did you hear the first part of that?
No, try it again.
I said there is a point of diminishing returns with a mandate versus a strong recommendation. And we don't want a replay of what happened to the video saloon. We don't want people injured trying to defend a mandate and trying to keep their place open. So we really do have a problem. And again, as Penny said, we're one of one counties that have a mandate. And what we need to do, what you need to do today is since you are the policy making group, is decide, and I would recommend, by the way, just waiting until it expires at the end of September, because it's not going to turn blue before there is, as Penny noted. So if you just wait and let it expire, at some point we need to protect the people, not only the employees, not only from COVID, but from people with knives and other means of harming employees. We don't want to get into that, and we certainly can't have, like the hospital has, a policeman at the door. Okay, every business can't have a policeman at the door, and as you, I mean, obviously, and you know, we have to remember that bars have to deal with people who may be somewhat impaired, so they are at a special risk in terms of bad behavior from patrons. So if it were up to me, I probably, but it's totally up to you, and this is what you need to decide. I would just let it expire. I would do nothing to the end of September, because we're not really getting much out of this, of a mandate versus strong recommendation. We still want to have the rules be the same, but people are not, you know, the ones that are not going to comply are just going to cause trouble. And the owner can certainly mandate that they can't come in there. And if they do, without a mask, and if they do, they can call the police. But that's only for really bad behavior. So again, I'm not sure what we're getting with a mandate over a strong recommendation. The rest of the state doesn't seem to think the mandate's doing any good. I'm not sure it is either. I would rather have the mandate, but we have no way to enforce it. So you need to consider what policy you want going forward as the board. You know, the health department implements, but you decide what the policies are.
Thank you, Dr. Sharp.
Yeah, I agree with everything you say, Tom, except for the fact that in states where they do have mask mandates, their rates are lower, their transmission rates are lower.
Where they don't have mandates?
Where they do have mandates.
Yes.
I mean, like, let's say Kentucky, right next door to us.
Right.
There are states that have mask mandates. We just don't have to be one of them. And they do work if people actually will comply. But I agree with you that it's a problem with people coming in trying to knife people. That's a really bad idea. And there is a balance there. I think every business has a choice to make. They can, you know, even if there weren't a mandate, they have a choice. They can mandate masks in their facility. For example, the hospital should not give up the masks. I mean, there's no doubt about it. I mean, they need to be enforcing it because it's a healthcare facility. Other healthcare facilities should be doing that. There are vulnerable people in those spots. So it's very clear that certain places should absolutely mandate it, you know.
Every business should be able to mandate.
Yeah, and people, and they can have the option of doing that.
Absolutely.
I think that people are very angry. There's people angry on both sides of the issue. I'm angry because I can't go anywhere because I'm an older person who's immune suppressed. I can't go anywhere. I'm really pissed off people aren't getting vaccinated. So I can go someplace. I mean, I'm angry too, but I'm angry for completely different reasons. But I'm not going to go knife anybody about it. At least not today.
Not today.
Not today. And you know, so I think that there's a lot of anger about this out there because there's a lot of things that aren't going as well as they could be. I mean, if people would just get vaccinated, we wouldn't have to worry about masks.
Yeah, this is as you've heard many times, it's the pandemic of the unvaccinated.
Exactly. They're the ones that are causing these new mutants. Now we have a mu variant coming out too. I mean, it's like, you know, and it's because people aren't getting vaccinated, but you know, that's not what we're talking about. We're talking about the masks.
I just heard the mu variant is in every state now.
Yes, I heard that today too.
But
and so
we don't know that much about it yet, as you know.
Right. Well, but we will soon. Yeah. The Delta's bad enough. We don't have to worry about that one right now.
And you know that 99% is Delta at this point, which is more infectious. We have a problem and a delicate balance. You have it right on. That's exactly right. And that's what you guys need to
Right. So I kind of agree with you. I think that we've made the point. I think, even I'm down in South Carolina right now, who they don't care about COVID at all. It's like it doesn't exist. And there are people wearing masks. I mean, when I was here last month, nobody was wearing a mask. Now people are wearing masks in South Carolina. So people have gotten them. There are people who want to protect themselves who are wearing masks. There's no doubt about that. And there's people who aren't going to do it no matter what happens anyway. I agree with you on that as well.
And the bad news, those are the same people that don't get vaccinated.
Exactly. So that's why I can't go anywhere. So,
I know, it's pathetic.
yeah.
The major value of the mandate is that it gives the proprietor of the store or business a good excuse for laying it off on the health department that people will be wearing masks. Now, there will always be some.
And I think maybe what we need, and that's what my point is, maybe we need to take the pressure off of the business owners and not make it, not make it the onus completely on them. Because basically say now, if you're not going to comply, you're getting fined, you have to enforce it, that kind of stuff. Maybe we need to continue the mandate, but not, none of our rules are 100% enforced. No rule law we have is 100% enforced. I mean, people roll through stop signs all the time. I mean, so there needs to be I think the business need to have the clout of the health department behind them if they would like to protect their employees and their patrons. They would, I think that we can provide that clout for them. It's kind of like bicycle helmet laws. It allows parents to say it's a law, put your helmet on. So it gives businesses the clout to enforce it if they choose to do it.
And I talked to Mike, so I see him almost daily, who owns the video saloon, and I asked him what he would like to see, and he was pretty clear that he's not willing or really ready to get rid of the mask mandate. He feels like his employees need to be protected, and the population needs to be protected. And he also noted, which is very true, this could have happened over getting cut off too. I mean, we just had whether there's a mask mandate or not, these kind of things happen in the bars. But he did say, which I thought was interesting, I'm just going to throw this out to you guys. He did say that if the board recommended that businesses, rather it as a recommendation that to enter businesses that you have to show your vaccine card. We know that there's issues with that, with forgeries and things of that nature. But his point is that it would allow businesses to be able to stop people at the door rather than once they come in the door into the building. Because this guy had his mask. He just was just being difficult. But he said that if they were required to have a vaccine card or proof that they were vaccinated, they wouldn't have to push the mask thing so much. It's just that you just wouldn't get in because you're not vaccinated. You just have to go home. So I just thought that was an interesting, conversation that I had with him. And I just wanted to share with you some of the things he had mentioned, because I don't see him today. Thought he was going to join us at join the meeting, but he's not super in favor of getting rid of the masks because of the pandemic. And I think a lot of businesses feel that way. I think the enforcement part is just that it's scary. And you're right, Carol, that it's really a minority of people that just get so irate about it. Most of the population is being compliant, and I think we're grateful that the mandate is here, and that I've been told that too, but that's not evidence. But so I just wanted to share that with the board, and I can take my hand down because that's all I was gonna let you guys know. That I just thought it was kind of interesting. He doesn't want to get rid of the masks, and he would like vaccine passports.
Mark, you have your hand up.
Yes, thank you, Kay. I have a framing question for Dr. Sharp and maybe Penny to weigh in on, and that is, we've seen some success. If you look at the map, we're kind of, Monroe County is kind of an island. And so you would have to ask, what is driving our county's good performance relative to other counties? Because there are multiple factors, including the mask mandate, that could be at the core of why we are orange and not red, or whatever it is right now. And that could be the mask mandate, or it could be a higher vaccination rate, which is in fact the case for Monroe County. So, and I know those two are kind of hard to separate. So that's one question, is that the data should kind of drive that decision on mask mandate. If we think that really the mask mandate has resulted in this county being in a better status, then maybe that's something we ought to consider, is extending the mask mandate. And also a comment before I hear the response on that. It's terribly challenging from the standpoint of the health department staff to get complaints and problems. But one thing I want to point out is that you don't hear from many businesses in town that are actually doing a pretty good job of it. That they are, in fact, just going along with it and being good citizens and telling customers and employees to mask up and having pretty good compliance, pretty good results with that. So, there's, I can't quantify, I don't know, but essentially, if you take the mask mandate away, I think Dr. Hegeman just said this, is that that's going to give people license to just stop doing it. And there's so many businesses right now who don't mind the mask mandate. They don't mind gently nudging, right? But here's another thing, is if we take the mask mandate away, then it's incumbent upon us as a board to explain cogently to people what changed, right? Because this is something that irritates people, is that everything changes. Like I can't keep up with all the rules. And, first you had a mandate, and now, it may be looking up a little bit, but it's basically the same way it was a month ago. Why now are you saying no? So there's got to be some kind of something that changed. And if that's in fact the risk of violence that changed, then that needs to be said. We're dropping the mask mandate because bad things are happening out there and people are in a bad mood and they're getting at each other's throats. So that's something from a messaging standpoint that if we do let it expire, that has to be communicated with that.
Mark, you touched on two things that I was going to mention, even though I didn't have my hand up. And that is the compliance. I think it's like most things, you don't hear the good news, you only hear the bad. And so you get an impression that so many incidences are happening. Now, I'm not minimizing the seriousness of a couple of those, and Penny certainly would be in a position she hears the complaints. I don't. But of all the people that visit retail establishments, let's just say on a daily basis, how many complaints do we get on a daily basis? I understand that some of them are just take place inside the business, but I don't think it's as bad as we might get the impression that it is. And the second thing is that exactly, if you look at the COVID map, our Indiana map, there are only 3 counties in the whole state that are doing as well as Monroe County. And I have to think that part of that, at least, is the fact that we have a relatively good vaccine rate in our county, or at least in our city, which makes up the bulk, I suppose, of the population of the county. And the fact that maybe some of the things that we've done, including the mask mandate, have had a positive effect on the number of cases in our county. So, group dynamics are usually governed by the worst behaved people in the group. And, I'm afraid that we're going to throw the baby out with the bathwater because a few people have behaved badly. And that's my 2 cents worth on this. But, you know, I'm like Carol, you know, I'm pretty ticked off that, you know, that our country is in the same state it was, and it's all, or virtually 90% or 95% of it is due to the people that are not behaving properly, not going with science, not doing the direction, not going the direction they should. So, yeah, I mean, they bear the responsibility. Out of 1,450 hospitalizations in Indiana in the last week of August, less than 20 of those people were vaccinated. The statistics speak for themselves. I mean, it's.
As an anecdote, I know at least several people who say they refuse to enter stores where there is a clear tendency to flaunt the mask mandate, typically on the west side.
Do you feel that the statistics, Penny, in our county are due to the fact that we have 40,000 college students come in that have to be vaccinated? Has that altered our statistics, put us in the yellow frame as opposed to the native people in our county? Can you help me?
Greater than 90% of them and greater than 90% of the staff also has been vaccinated. And so, yes, of course, that would skew it some, but there's, you know, there's Purdue and there's South Bend, you know, Notre Dame, and it's Porter County and LaGrange County are the two, and they're way up north and kind of, I don't know, they're a little, those are not major anything. I don't know why those two. But it's multifactorial. You can't just say it's the mandate. You can't just say it's the students, and you can't just say it's just this and this and this. It's a whole bunch of things.
One thing to think about, though, too, is from a statistical standpoint, is one reason that we might look good in Monroe County is the university is doing a bang-up job of testing students and faculty and staff. They're doing so much testing that the positivity rate is low, and that's one of the factors that goes into that red, orange, yellow calculation.
They mentioned in the Zoom meeting last hour that they're testing symptomatic people in a very low number, and he didn't actually give the number, but he said a very low number of those have COVID. There are other respiratory viruses going around it. So yes, from last July, Dr. Carroll has just done, when he came out with that plan, I was just amazed and in a positive way what IU was going to do, and they have followed through and have been really good. So, and they're greater than 90% vaccination rate is a follow through of all that.
But it's noteworthy that this summer, before many of the faculty and most of the students returned, we were still a heck of a lot better than most other counties in Indiana.
That's true. Margie, you wanted to say something?
Yeah. One of the things as a policy, board, I think you guys need to think about when you heard Penny talk, and this is something I've talked with Penny about, and we talked with Dr. Sharp, is where do you want your health department staff resources spent? So we know that vaccinations save lives. We know we have a lower rate of vaccination than we would like. We know that we have local ARPA dollars, and the commissioners in the county are thinking about how do we spend those funds. One of the council members, when I compiled their list of things that they were interested in, was looking at how do we expand Monroe County's public health capacity, and also how do we encourage vaccinations. Penny and her staff only have a limited amount of time each week, and it's a fact that they're spending a lot of time on enforcement. We had a comment about, because there was a comment about, are we able to enforce or not enforcing? We are enforcing. I mean, that's taking up a bulk of Penny's staff time. every week is following up on complaints and talking to people and trying to voluntarily get compliance. They're doing a great job. But the fact of the matter is, every time they're doing that, they aren't spending time promoting vaccinations and encouraging vaccinations and trying to get our vaccination rate up. So I think as a policy decision you guys have to make, I know the sun's coming in, a policy decision you guys have to make today, I'm sorry, the sun is falling, is what do you guys want the health department to focus on? Do you want them to continue to spend their weeks on mask compliance? And it's a battle, you know, people will call, they'll hang up. I mean, it's not being ignored, and follow-up is definitely happening. One of the things I like to tell people is people will say to me, well, they're not doing anything. How do you know what the health department is doing all day long? You don't know what the health department is doing all day long. You don't know what I do. You don't know how many follow-up calls we make. You don't know how many letters we write. Just because you don't hear about it doesn't mean it's not happening. It's happening. But do you want Penny and her staff doing that, or do you want them to focus on getting Monroe County's vaccination rate up as high as they can get it and really take a positive step in that direction? And if so, we're going to have to make a policy decision about where the resources are going to go, because they can't, you know, there are only so much time and so many people. So think about that today, and you know, set some priorities.
Maybe Penny could comment on that. Is what, you know, if resources were shifted, what would the actual time and effort be spent on in an effort to get more people vaccinated? I mean, is there actually a potential for, you know, vaccinating a whole bunch more people if you take an hour more of staff time instead of enforcing? I mean, you know, you hear about hesitancy and like what actually could be done in that regard. That's the $60,000 question, is how do you move that? How do you know?
Well, and one of the things I think, you know, people are talking about, you know, money talks. I mean, is there any sort of incentive with ARPA dollars? ARPA is intended to try to do a lot of different things, and local governments have discretion. So the commissioners and the council haven't decided how they want to spend ARPA dollars and how much of it, if any, is going to be focused on COVID relief, and helping the community bounce back from COVID. But I've heard Penny, and Penny, you can talk about this. I've heard Penny talk about, you know, her staff strategizing and having priorities, perhaps having a, you know, mini retreat to be able to sort of set goals and priorities. And that's something that, you know, could be funded with ARPA dollars if they don't have budgetary dollars, but being able to develop a plan forward, and maybe ARPA funds are part of that plan forward, you know, to move the needle. But Penny, do you want to talk about that at all?
Okay, sorry. Sure, I think that, you know, the things around increasing vaccine uptake, I think really have to do with probably a good campaign for that, coming up with strategies and how we reach those that we're not reaching. So Amy talked about earlier, we used some grant funds to hire this outreach worker, Syria, and part of their job is to make those connections, but to be able to develop that more fully and really do an assessment. Can we do a survey and find out why members of our community in particular maybe are not vaccinated? Is it that they're not getting the message that there's free rides if you have an appointment, so transportation doesn't have to be a barrier? What are the other things? Is it about misinformation or not having enough information, being able to address those? Even when we think about doing publicity, it takes time to pull that information together. You know, you think about put up a billboard or do this ad, but it takes some skill and resources to put those things together. I think that it's a delicate balance. I'm going to tell you, I don't have the exact answer for you. I think all the comments that you've made are true. And, you know, we have talked about that a little bit about, yes, I think that there are people who are very happy that we have the mask mandate and feel like it's, you know, been very, very helpful, but it has also created a lot of turmoil. So is it getting people to wear them? I think one question might be, is the mandate making people wear them that wouldn't otherwise wear them, right? Or is it that people who are wearing them would wear them anyway? And I'm sure that there's some of both, right? There's no black and white, it's one or the other. It's somewhere down the middle. But those would be the things that I would think about. Security Pro does go out. We've developed a checklist this time around with them. So when we get phone calls and we make our internal steps initially start with receiving that complaint, we make connections to follow up on those complaints, and then we give that list for further follow-up to Security Pro, plus they do random stops, and then we get that checklist back.
You know, I'd like to hear from them how that's going to begin with. But the other, I think that what, you know, I am concerned about the businesses. I think that we need to support them in however we can. I think that some of them really do want to have the mandate. It's very clear that when we had started the mandate back again, people started wearing more masks. And I don't know if it was because we had the mandate or the fact that Delta variant was getting worse, people got scared. You know, it may be true and unrelated, but it's very clear that when we did start the mandate back, people started wearing more masks. And, you know, there are people who are always kind of on the fence, and if, you know, if they would, that just helps to move them over there. There are people who aren't going to wear them no matter what, so we can't do anything about them. But I think if we can do things to support the businesses, I mean, now that Pfizer has full FDA approval, businesses can require their employees to get vaccinated. Maybe we need to be working with business to get them the incentive to do that. My daughter's business, she is given bonuses to people who are vaccinated. There are businesses who have health insurance surcharges, people who are not vaccinated, because that's what really, I mean, when you come down to it, money, I mean, people who are not vaccinated are costing our healthcare system a whole lot more money than people who are vaccinated. It comes down to, if you want to get down to money, they're the ones that are causing healthcare costs to go up. And all of our insurance costs are going to go up because of this. And I'm going to be paying people who aren't vaccinated.
The question, and that is whether or not we could expand the cadre of compliance officers to handle some of those complaints that come in. If many of them are relatively routine, they might be able to take some of the load off Penny and her staff. Is
Well,
that an option?
Well, it may be an option. They're more expensive than our staff. So when you talk about resources, we're paying them more than we're paying most of our staff. And they generally are out. So what happens when the complaints come in, then we have staff who are monitoring that complaint line and those emails and process those initially. So we could do that. It will cost more money to do that.
Penny, I want to ask a question. When the complaints come in, have there been fines that have been levied?
We've only issued the one citation this fall that we have the appeal on. And we never like to start there at all, but we will certainly go there. And that means then we're taking up more legal time as well.
I have a quick question. I'm sorry. What is, Penny, do we have like an end goal for like what we want to see a percentage of our population being vaccinated? You know, I mean, granted, 100% would be fabulous. We know that's not going to happen. 90 is not going to happen without a mandate. I mean, that's why IU is doing so well. And their mask enforcements that they're doing. So I'm kind of curious, what's our end goal?
Yeah, I don't think anybody has a specific, there's no magic number, as high as we can get it. I will tell you that we hope that we would top that 60% back this summer. We were hoping we would hit 60% by, June or July. And we're still not there. We've seen a big decline in it. Just there for a while. It was a really steady, even when it slowed initially, it was steady. And now there are days where the needle doesn't move at all, right? So there's no exact answer. Initially people talked a lot about getting the percentage high, so we had herd immunity, but it's really just the higher we can get it, the better off we all will be, because we'll have fewer variants floating around or the possibility for more variants and less spread. So, we're just trying to offer it every way we can. One of the things that we're hoping to do with the new testing site that I mentioned is also be able to have vaccine there as well.
Yeah, actually, the answer to your question is to get herd immunity, you need someplace around 85 to 90% of the population vaccinated, which, which we manage to do in children all the time. So we do that in kids constantly. And so that's what you really need. Now, some people are going to have immunity because they've had the disease, but we don't know how long that lasts. And the problem with COVID is that this is a highly, highly infectious disease that may not behave like some of our traditional diseases we're giving vaccines for. So it may actually take even more than 90% to get rid of the disease. So the answer is we don't know, because COVID is so different than anything else. And it's so much more infectious.
Did our numbers go up after FDA approval? Because they went up nationally.
No drastic change.
Yeah. So I'm just kind of wondering if we're flatlining here.
Yeah, I think the thing that changed after FDA approval is that businesses could mandate it, and many did. Yeah. And I think that's one thing that our outreach person can work on, is working with businesses to try to talk them into mandating it, or having them give incentives to their employees to get vaccinated, working in terms of getting some of those people who have not shown up already, and trying to get some of those people to get vaccinated. But because obviously putting out, billboards and PSAs isn't working anymore. Everyone's heard it. They all know that. Everybody knows they're supposed to get vaccinated.
Yeah, you're right.
So
I wonder.
Yeah, so we need to try to reach that population through other methods. The classics are, and is getting the vaccine anywhere people show up for healthcare. Well, right now it's not. It's only in pharmacies and a few other places. So, like, if you go to your internist, they don't have the vaccine at IU Health. But you have to go someplace else to get it. So you can't just show up there and they say, oh, you haven't had flu vaccine, can we give it to you? I mean, just like they do the flu shot. I mean, you show up there, and if you haven't had flu, your doctor's gonna say, I can give you the flu shot. You want it today?
Every provider at this point can have it in their office if they want it.
Yeah, so I think that's another thing we can work on, is seeing if we can get like IU Health to have it for their providers. They're the biggest healthcare system in the county. Why isn't IU Health have it in their offices?
They are. Yeah,
they should.
I understand that they are working on that. So it is.
So my point, Ashley, is we're going to have to approach that population of people who are not vaccinated through other means, as opposed to PSAs and billboards, because everybody knows you're supposed to get vaccinated at this point.
And that's where my point. I'm just wondering how many more are out there that can be turned, or I don't know what that it would be that we could move. I'm just wondering, if we've hit the ceiling. And
I think there are people who could be swayed, but you've got to make it easy for them. Got to make it convenient. You got to go out and get them. You got to get them where they work. You got to that kind of stuff, because that's you're not going to get them by saying, we got a clinic now, come on and get it. They're not going to do that. They're not going to show up there. You're going to have to go out to them and do the outreach and get them there.
Right. And that part I understand.
Family practice, the IU Family Practice has a kind of a drive-by on Clariz. It's out on the sidewalk. And I understand the peds do also up near the school up on the north side.
For getting vaccine or for getting tested?
Vaccine.
That must be recent, because it hasn't been before. Okay.
Well,
yeah, but still.
Dr. Dukes mentioned that this morning.
Okay, so that's brand new. That's great because when I wanted to get, since I wanted to find out where I could get my third vaccine, I called my internist. She didn't even know where to go. She had no idea. So I informed them once I figured it out. But I mean, they're off said, I don't know. That was the response I got.
For the board, keep in mind that you don't have to do anything today because you have a mandate in place until, well, for 22 more days.
Yeah.
So, and today, maybe you just need to think about this for a while and decide how you want to do it. This is an informational thing and discussion of opinions day. You don't have to decide anything today.
Yeah, I think that's a good suggestion, Tom. And we can have another meeting in 3 weeks. We have to do it so the commissioners can ratify it though, right? So we'd have to probably a little less than 3 weeks. Correct, is that right, Margie?
If you keep this one in place, it's the status quo, then it's already been approved by the commissioners. And so it'll just stay in place. I don't think if you don't change anything today and just keep it in place,
right,
and no further action. I do think that I want to address Ashley's comment about her question, have we flatlined? Penny can speak to this. I don't know if we can answer that because I certainly hope the answer is no, but we haven't been able to lodge a full-blown campaign to get people vaccinated because just as I think the health department was thinking about doing that, here comes COVID again and the Delta variant, and they didn't get, a chance to really focus on that. And I think that what Carol says is exactly right, is we have to take a targeted approach, work with the chamber, work with businesses in providing incentives for people who, to encourage them to get the vaccine, not billboards, maybe working company by company. Again, thinking about what incentives we might have to be able to provide. And also, I think it was Dr. Sharp that mentioned today that, either Penny or Dr. Sharp mentioned that there was a doctor said, I'm not going to see you in my office if you're not vaccinated. So when it becomes harder for people to do the things that they want to do in the world because they're not vaccinated and the doors are closed to them because they're not vaccinated, it may change their behavior. So I think we have to really, Penny and her staff need, and this is where the board comes in, please direct where you want the resources spent. And do you want them to focus on, really trying to move the needle on vaccinations? And is that where the time and energy should be spent? And that's, I think Penny probably needs that direction. Penny, do you want to talk about that at all?
Yeah, I think the whole conversation really, I think, has been around that, but that is what we need. We've got staff who are doing their jobs, who are dealing with their facilities. Keep in mind, we have over 600 retail food establishments, and that's just the tip of the iceberg of all the businesses. So even contacting all the businesses in town to work with them is a large task, and I think that's a great idea. And we can certainly use the chamber, and we can use other groups to help us work with them, and we've done that. But yeah, knowing where you want the resources. I think that part of the problem with enforcement, and we've talked about this before, there are lots of laws. You mentioned speeding as an example, which isn't ours, but you think about those. It's when we get the complaints that we have to respond, right? That we have to follow up on those. And oftentimes, and Margie, you can talk to me about, you can talk to us about the legal ramifications, is what is compliance for us, right? Is it 100% that you're compliant, or is there a level of compliance that's acceptable that isn't 100%? So those are just the kinds of things. If you want to sort of think about this and come back to it, in another week or 2 weeks, that can certainly be done. The one thing, excuse me, that I know schools want to know is, are you as a board fine with us allowing the schools, do you support the schools following the state's options in terms of quarantine? So that would be the one thing that I think we absolutely need to be able to give the schools today. Our current order would allow them to do that because it hasn't, you know, it's really about quarantine, and we say follow the state guidance. So I think they just are on here because they mostly want to know if that's even an option for them.
I don't have any problem following the state guidelines. I mean, it may or may not work. If it doesn't work, we'll find out fairly soon. So I think that I don't have any issues with following the state guidelines for quarantining.
Now, if I understand it correctly, you just stated that we are currently, our recommendation is to follow the state guidelines, right?
Yes, and this is an option for them. So they just want to make sure that we're not going to say,
Change.
Yeah, exactly.
Okay.
I think it's really important to keep kids in school as much as possible. And if everything else is a balance. And I think there's some good rationale behind their quarantine recommendations. And they've obviously looked at it thoroughly. And so if it encourages people to wear more masks, I think that's a great thing.
So do we need a motion for that, or?
It's not currently in the regulation. So would they need a motion? Or are we good with them just, Margie?
I mean, the schools are required by state law to follow the governor's order. So I think that it can't hurt to have a motion to make clear what this board's opinion is. I think the motion is that you will, you encourage and and recommend that schools follow, the guidance of the governor's order.
Then I would move that.
Okay, let me be really clear, because this isn't coming from the governor. This is coming from the State Department of Health regarding options for schools. So I would see this as we would support the schools being able to choose which option they use based on the state's recommendations. Because it is about options.
Since we require masks basically anyway, although the little glitch there is if you have a child who has a medical exemption, then they won't be able to follow those guidelines anyway. So I think all we need to move is that we support following the State Department of Health guidelines for quarantine in schools for the current time.
I think that
we can always change our minds.
Great.
I second that.
Yep.
So that was a motion, Carol?
Yes.
And that was a second, Mark?
Yes.
I'll second.
Okay, we'll have a roll call. Cranner?
You're muted.
Yeah, I can't get to it fast enough, everybody. Yes.
Hageman?
Yes.
Norrell?
Yes.
Richard?
Yes.
Talukian?
Yes.
Wren? Wren, you're muted. Bob, you're muted.
My bad. Yes. And Steve, you wanted to make the same motion, so you get credit for it too.
We just want to move things along.
That's it. Let's just move this along.
I also vote yes. Okay. So it was unanimously a yes. For what it's worth, I want to say that I see people wearing masks now where I wasn't a few weeks ago. And I'm proud that I live in a county where we're yellow instead of red. And I wish we were blue, but we're yellow and we're one of three, I think. And I'm proud of it. And I support the wearing of the mask. And I hope that we keep the mandate.
And I do have a question, Penny, about who's getting COVID. I mean, I know they're unvaccinated people for the most part, but where do they live in the county? Who are they? Where, are they getting it in bars? Are they young? I mean, I realize they're mostly younger people. Who are they?
All ages. We are certainly seeing cases in younger people where we didn't before. And even in terms of the deaths that we've had, you can see that we've had younger people where we, you know, it was 60 and over, and now it's people who are 50 and over who are residents who have passed. But when we look at it, it's all over the county, and it's all ages. I mean, we see people who are under 2 years old, and we see people who are over 80.
Do we know where they're getting it? Are they getting it out in retail areas? Are they getting it from their family and friends? Are they getting it because they go to parties? Are they getting it? I mean, where are they actually? I mean, I want to know who to avoid.
Yeah, you know, that can be a really tough thing to figure out. But I would say all evidence points to families. We see it go through families. It's those gatherings, and I think gatherings where, especially where people maybe don't know if everybody's vaccinated, or, you know, even maybe this gathering, everybody has been, but they've been to places where not everybody was, and just maybe letting their guard down in certain places. I think that in terms of families, isolation and quarantine has probably not been as strict as it once was when we knew less. And with Delta, it's easier to transmit. But certainly, you know, we still don't see a lot of obvious spread within the schools, right? We see people maybe with a family member, somebody, and then they came to school and then they got sick or something like that. But when you start looking at close contacts in the classroom, we're not seeing a lot of that. And, you know, in terms of businesses, you know, you might see some employees who, again, they are friends, they hang out after work, but not a lot of places. There have been camps, you know, there have been, you know, religious, you know, church affiliated groups, those kinds of things, some camps reported just across the state of Indiana. Social gatherings where people let down their guard.
Friends and family is what you're saying.
Yep.
Okay.
So I think the question is, what do we want to do about the mandate? Is it something you want to continue to think about? Is it something we need a motion on? Is it something?
I think we should I think we just keep it the way it is now and just think about it, but come together again with sufficient time before the end of the month when it expires to decide if we want to continue it again. Discuss it more. So it's and in time so that we can, if we want to continue it, the commissioners have time to act on it.
If I could, I agree with that, but you know, I want to respond to something that Penny teed up. She kind of asked this question about enforcement, and you know, is a mask mandate something that you enforce 100%, or do you enforce it less than 100%, right? And that is it's very much akin to this analogous situation of speeders, people who violate speed limits. And the police are sitting there going, well, is it a law or not? Do we enforce it 100% or not? And you cannot, you know, the health department cannot enforce it 100%, even if you hired another 4 people for Security Pro, right? And that you do the best you can do, and that's all you can do, right? So I know it's frustrating from a staff time and response, but you can't communicate this idea of we've got a mask mandate, but you know what, we're just not really going to enforce it. That can't be the message.
I think the message should be we expect you to enforce it to the best of your ability, which may not be 100%, but to the best of your ability. And I think if people are making an effort, no effort's 100%. Nothing we do is 100%. So, I mean, vaccines aren't 100%, but if we can, if we just, I think our expectation is that it is enforced to the best of their ability, but not to the point of putting people in harm's way. just like, we have that thing that it's not okay to harass people who aren't wearing masks. There's a limit to how far that it's reasonable to go with it. And I think that, I know it takes a lot of your time, Penny. And maybe, your response is, we got this complaint from somebody about, your establishment. Do your best. Maybe that's the response to it, as opposed to, going to a whole lot of big, I mean, I think you need to respond to it, but maybe we don't need to, you do it with a tack hammer instead of a sledgehammer.
If I can address that as well, I think Penny and I will continue to talk on a regular basis as we do. And Penny she and her staff do a great job. As with any enforcement, there's discretion. And so you look and see, where are the biggest offenders? Where are the complaints coming in? Most times, and Penny, you can correct me if I'm wrong here, when a complaint comes in and they're followed up on, 99.9% of them are taken care of through a conversation, and voluntary compliance is achieved. So, and then, she and Security Pro have regular conversations, and then they might hit a couple businesses a little bit harder. The message should not be that there are people out there just completely giving the health department the middle finger, because that's not happening. Now, we have had the Seven Oaks, that's, been in the news, they said, hey, we don't think, we think we have these other obligations to our children, and we think those obligations trump this. Citation was issued, an appeal was provided to the commissioners, and the commissioners have to have a hearing on that next week, and they are. So while that administrative process is going forward, no further action was taken, because that due process has to be followed. But there are not great swaths of people who are ignoring the mask mandate. I think it's Penny will continue to use her discretion. We'll try to exhaust all administrative remedies and only take the ones to court that really have to be taken to court. Because again, the expectation before you go in front of a judge is that you try to do everything you possibly could short of judicial intervention. They don't want to be your first line of defense. So we'll continue to do that. I do think that, Spenny and I have talked about, think about what resources we can put towards, getting the vaccination rate up, because that saves people's lives. So I just wanted to hit home that it is not as if, I've heard people say we can't enforce. It's true, we can't enforce 100%, but we are following up on the complaints and are using discretion and dealing particularly with, problem areas. And I think Penny's also looking at things like, where there are hot spots, if there are any sort of hot spots that are coming up. And I don't know that you've really had any, Penny. Have you had any areas like that? I wanted to say one more thing, in clarification for the members of the public about the schools and the governor's order. And I hope I can share my screen real quick. Can the host let me share my screen, TSD?
Just a minute.
Okay. I just want to be clear, because I know there are some, I see some people from the media on this, and I want to share this so that people understand what we're talking about with the, this guy. This is the latest governor's order. And here was the K through 12 educational institutions. And it said local restrictions and measures subject to pertinent statutory provisions, executive order, local ordinances, etc. All public and private K through 12 educational institutions and childcare facilities are responsible, for implementing local measures and restrictions to address the impact and spread of COVID-19 in their buildings, facilities, and grounds. These restrictions and measures may be more restrictive, but not less restrictive than required by statute, executive orders, local ordinances and directives, that's yours, and state and local health orders. The Department of Health has updated its school guidance to assist local school corporations, which may be found at that link, and that's what Penny was referencing. And then it says K through 12 educational institutions and childcare facilities must continue to perform contact tracing, provide parental notification to close contacts, monitor symptoms, etc. And then they did say, he directed the commissioner of the Department of Health to evaluate, modify where warranted the quarantine provisions for individuals who are close contacts. So, and those are the new provisions. So that the Department of Health put in place. So what you guys voted on today was that schools are supposed to follow this order that references the Department of Health procedures. Does that make sense? Do you have any questions about that, or I just want to make sure it's clear to you guys and clear to the public? It's this latest order, and then the details about what the Department of Health is doing can be found at that link. All right, does that make
Anybody
sense?
have questions for Margie? Thanks, Margie, for clarifying there. Well, any other comments?
I have one final question for Penny. How many cases on an average week, complaints, are you actually getting in about since the mandate went into effect? I mean, is this a huge problem?
Well, and I don't have those exact numbers at my fingertips right now.
Well, like
but we have staff who don the call line daily. We don't have as many as we had last spring because we only have we really only have one thing to complain about right now, right? It's just the masks. So last fall we had a lot more complaints come in because some of them were about distancing, and sometimes they're still about distancing, even though that's not in the current order. So we get a lot of calls. I guess when I think about complaints, there are some that are official. People have filled out a complaint form that we process. And then there's the number of hotline calls that we get. That goes to, we have 1 to 2 people who man that. And then the calls that come in to Vital Records, and they may take 100 calls a week. There was one day where I can tell you for an hour, they did nothing. Almost every call for all 4 of them were somebody calling to complain. And then I got a couple of those myself. So we get a lot of calls that are complaints. Not all of them are official complaints on a business. So it's kind of hard to give you a number, but it varies from day to day. We may have one day where we only have 1 or 2 complaints, and a lot of times we see the same complaint about the same business. Sometimes it's the same person who's filing a complaint. And we talked about this before. Sometimes you go in and it is about the level of compliance that someone sees, right? So they may go into a business, they may feel like nobody's wearing a mask. We might go in and everybody is masked when we go in, right? And I'm sure you all experience that kind of thing too, right? That you go in somewhere and you think, wow, they look like they had really high level of compliance. And somebody else says they go in that same place and they feel like nobody's compliant. And that's part of what we run into when we're doing those investigations. I can pull that number of calls and what have you and provide that for you at the next meeting, but I don't have that at my fingertips.
Is the call center, is that not something we could use volunteers or interns from IU, students from IU, or volunteers to do, or is it too specific?
I think it's pretty specific. We've got people who, last fall, we hired, what we lovingly call our complaint takers. That's not their official title. And we have one and a quarter of those people are still left. And so they manage that. So they've been staying up on those issues. They're able to answer those things really well, as opposed to bringing in we could use an intern, but then you have to train them and you get caught up into that. And so the staff that we have are certainly able to stay up on that. And they were hired for that specific purpose.
Carol, your box is on. Do you have a question? Okay. Penny, do you want to vote? Do you want us to vote on what we're going to do with this? Or Carol suggested that we think about this and come up with a decision at our next meeting. Is that good enough, or do you want to vote on it?
I don't think that you need to necessarily vote if you're not making any changes tonight. I think you could just determine, if you want to meet, for instance, on the 23rd of September or something like that, decide when you want to meet and then take it up. Then you would vote at that time.
I agree.
Okay, we're down then. Anything else on regulation? Anybody want to say anything else? Then we're down to board member comments. Any comments you have on any other thing besides regulation?
I'd like to comment on the fact that we keep circling back to the issue that you don't hear about certain things. And one recurring theme is that in talking with citizens, business owners, people at the university, all have expressed really strong appreciation for the strong, calm, respectful guidance from the health department and especially from Penny and Kathy. And of course, the other members of the staff too. It's been tough, but you are appreciated. So even though you don't have a telephone line to get all those thoughts, they're out there and they're due you.
Thank you, George. That's something all of us feel. Let's talk about next time we meet. 2 weeks from today is the 22nd. Can everybody attend on the 22nd? Or do you want to go to the 29th? Their order runs out on the 30th. We could go to the 29th.
The commissioners have to ratify.
Yeah.
So they meet Wednesday
Let's do
morning.
the 22nd.
22nd?
Yeah, they meet Wednesday mornings. The
Well,
commission.
we could do it like the next week, but do it on Monday or Tuesday instead. Because Monday's probably not good.
Tuesday's the 21st.
If you
Mine's the 22nd. If you want to do it a little bit later to see how things are going, we could do it the 27th, the 28th, because commissioners meet on the 29th, right?
They do. One of the things that we ran into before, though, Penny and I ran into, is their deadline for submitting things is a Friday. And
Okay.
so I don't know, Penny, what you think about the timing. It might be better to have the Board of Health meet, let's say on a Thursday, so that you can then get
But
it.
then the 22nd or 23rd would work.
Do either one.
Is there anybody who cannot attend but on the 22nd or 23rd? I do need to tell you, I'm going to be out of state. I will take my iPad with me, but I don't know that I'll be able to connect. I'll try. Ashley, you may have to take over for me, but I will hope to attend. George, you had your hand up.
I can't attend the afternoon of the 23rd, Thursday.
So we can do the 22nd though? You're good on the 22nd?
Could you do?
22nd.
Everybody okay with 22nd?
Yeah, I'm the same way. I won't be available on the 23rd, but on the 22nd, I can meet as long as it doesn't run past 5 o'clock.
Okay, how about we say 3 o'clock on the 22nd? Does that work?
Works for me.
Okay, it looks, Penny, that work for you?
That is the last day of our Environmental Health Association conference, but I think that 3 o'clock should work.
Would you rather make it 3:30?
Extra half hour would be helpful for me if it doesn't create a problem for the board members.
Okay, let's say 3:30, and Mark, if you have to leave early, we'll try to move things up that are things to vote on. So let's say we'll meet at 3:30 on the 22nd.
I can do that.
Okay. Well, thank you, everyone. I'll see you on the 22nd. We are adjourned.